All right, looks like we have almost a dozen people here. I'm Martha Barbone. I'm currently the secretary of the I.N.A.P.S Board of Directors. And I'm very happy today to be hosting our 41st webinar. Thank you to all who have been here before. And if you're new to this, you can find all of our webinars starting with number 11 up until this one. There's recordings on our website. I'm going to go through some logistics first. Just thank you all for participating. We always put the disclaimer in there that the opinions expressed are those of the presenter, not necessarily reflecting the opinions of I.N.A.P.S, but we are open to all. We are recording this webinar. The chat actually doesn't record, so your name doesn't appear anywhere in the recording, even if it is in the chat. We asked during the presentation that you stay muted and don't use your video. This toolbar either appears on the top of your screen or the bottom of your screen. I think it depends on what platform you're on, but you can mute yourself, you can stop the video. This is also where you can access the chat. And we will be asking questions. I think Michael will be asking questions during this, and you can answer them in the chat. You can also ask questions in the chat. Sometimes we share resources in the chat. I do download the chat at the end, so if there's resources there, I will put them on the website with this webinar. Again, when you're chatting, you can send a message to everyone that's involved, or you can just send it to a specific person, and you can select that in the chat feature. If you want a certificate for a contact hour, if you need it for your certification, there's a short quiz. You just email me at membership@inaops.org. and I will send you the link to the quiz. And once you complete the quiz, I'll send you a certificate. The quiz and certificates are only available to paid members of I.N.A.P.S. So if you're not a member and you would like this, it's only $35 a year. I would encourage you to do that. You have access to this webinar and all previous webinars. So without further ado, just a little bit about our webinar today. I met Michael Lane actually at the I.N.A.P.S conference in Orlando last December, where he did a workshop on design thinking, and I had no idea what he was going to be talking about. And I really enjoyed his workshop. It went over very well, so I invited him to be here today. I'm not going to say a lot about him because I believe he'll present himself during his presentation. Bear with us a minute. I'm going to stop sharing my screen and turn control over to him. So it'll be just 1 second and we'll get you to, let's see here. You got it, Michael?
Here.
All right.
Hello, everyone. Glad to be here. Let me pull up the chat here. So I will be monitoring the chat as we are going along. So yeah, I'm Michael Lane. I enjoyed attending the I.N.A.P.S conference, and this is going to be a little bit of touching on some of the things I talked about at that conference, if you were there, or it will be also kind of elaborating on this because it's a different format. So currently, I'm the Director of Individual and Family Affairs with the Fairfax-Falls Church Community Services Board in Virginia. That I do not work for a church. The Falls Church is a city here in Virginia. I get that question a lot from folks out of state. So who am I? I started my career working in this field as a peer support specialist in an outpatient mental health clinic for 3 years in Sacramento, California. I have my own lived experience with serious mental health challenges, or as some would call that, including homelessness and all sorts of negative consequences from things that were occurred in my life. Before I did this work, I did a lot of theater and including being a theater director. So coming into working in peer support services, I wanted to bring a lot of the creativity from into this work, and design thinking is one way I've done that. I do have a master's degree in organizational development, and part of my own personal mission is to help peer organizations and behavioral health organizations to be healthier, stronger, support the voice of individuals with lived experience, and to help peer support services to thrive and provide the support needed. So let's talk about what we're going to do today. So we're going to talk about how the values of peer support and design thinking overlap. Design thinking might be a very new concept to some of you, or it might be something you're somewhat familiar with. We'll discuss some of the basic principles of design thinking, and that'll mostly just be kind of woven into our conversation. We're going to talk a little bit about the limitations of the usual processes for generating new ideas and programs. And then we're going to learn and practice 2 design thinking tools. So there will be several times throughout this where I will be asking folks to type in their ideas into the chat. This is an interactive webinar. This is not just me talking to you the whole time. I'll be conveying some information. We'll be doing some activities together. So please make sure that you can chat. I will be, for those on the phone, I will read responses out loud so that you are aware of kind of what's going on in the chat. So what is design thinking anyway? Part of the idea behind design thinking is that creativity and creating something new and innovative doesn't just come from nowhere. Rarely do you just have one idea and then you can put it into practice right away, and that's exactly as the idea came to you. Usually there's ideas and there needs to be kind of a process for generating creativity. I see someone says they don't have a microphone. That's okay. You don't need a microphone for this at all. The only discussion we'll be having is in the chat bar. So one of the part of design thinking, there are several models today that we're going to be talking about a couple of them. The idea is that there's going to be a lot of confusion when you're trying to deal with a problem. We're trying to think of a solution for somebody or for something, that there could be a lot of confusion like this diagram here. And the design thinking is a structured way of taking that confusion, that mess, developing, looking for patterns and insights, doing research, prototyping solutions, developing more clarity, designing an approach, a potential solution. Some people talk about user-centered design, and that's a concept from product development. Things like the iPhone and other things that use user-centered design. And peer services or behavioral health services, user-centered design would be the individuals using the services. So how do you develop something that is actually going to meet the needs of individuals who are using your services, or who have needs that you are trying to meet? Perhaps they're not using them. So one of the things I like about design thinking is their processes are like recovery, if you like the word recovery or not, but whatever word you want to use. That, of course, we sometimes have an expectation, or many people have an expectation, that recovery is linear, that you start from one place and you go and you increase until you get better and better. And of course, we know that is generally not how things proceed. And the reality is much more complex, much messier in our lives. So design thinking is sort of looking at and kind of untangling that and going back and forth and failing fast, and then going back and learning from that failure, then growing and developing. So design thinking does all those things. And there are some definite values that are overlapping. And peer support, the values of connection, of deep empathy, of shared experience, of experimentation. Design thinking is very similar values, and this is not a comprehensive list of where you're really trying to find out and look at the person. And we talk a lot about being person-centeredness in this field, in this area. But I think we don't always have a lot of tools for how to make things person-centered. We have some tools. Design thinking is one way to make systems and programs to create them in a person-centered way. All right, so let's look at some design processes. So what IDEO is a company based out of California. I'm from California. I recently moved to Virginia. They have designed some things for the space shuttle. They have done all sorts of stuff. So they have kind of codified one of the major models for design thinking. This is not the only way but I will be touching on it this way today. So the idea is when you're trying to solve something or create an innovation, something new, that you got to start with empathy. That way you're really doing a deep dive into empathizing with what the person whose needs you're trying to meet, what is really going on for them. Trying to, from that, define what the actual problem or what the thing you're trying to solve or what is going on. To ideate, which is basically to develop ideas. Some people would call it brainstorming. It goes beyond that. And to do that in a really structured way. To prototype a solution, that means trying it really like duct tape and bubble gum. You literally using cardboard. Some of the when people design apps, they oftentimes use a construction paper and markers to draw out what each screen's going to look like, and that's how they prototype it. They don't put it on a computer first. And testing, then testing. So usually the usual process is folks don't spend much time at all empathizing with what the real users or the individuals' experiences are. They might spend a little bit of time trying to define the problem, but not a whole lot. It might be really something quick, like there aren't enough hospital beds, and that's the definition of the problem. So as we know, that the real problems are much deeper than hospital beds. There are some fundamental problems that are not about the hospital beds, because that doesn't really talk about the people. It talks about the process or the institution involved. So a lot of times folks will start with just kind of a brainstorm. Rarely are things actually prototyped. Oftentimes things are tested. So what could that look like? So for ideating, developing ideas could be a group brainstorm, stakeholder work group, committee, might be an executive pet idea that somebody's had that they want to do. So when generating, so this is the time for you to use the chat. What are some ways in your organizations or that you have seen that people tend to ideate? That means try to think up new ideas. Look in the chat. Yeah, the question is, what do you mean by executive pet idea? Sometimes somebody will have a thought that you'll be an executive director, or there'll be a big boss that'll say, hey, I really was seeing this, I really went to this conference and I heard about this thing and I think we should do it. That's, and then everyone else has to proceed along. So I see Martha says brainstorming sessions or surveys. Yep, those are some ways. What are some other ways that ideas are generated? So Christy says, as part of the process we use in delivering family support partner services through the high fidelity wraparound process, we have a brainstorming option with the family, youth, and team. Yeah, so convening a team, family, youth, and other members on the team to come together to think about different ideas, solutions. So yeah, there's lots of ways we can but we tend to have a few tried and true ones that we go to. There are lots of other ways we can generate ideas beyond them. Research literature on the issue or topic, good. Bernadette says she walked into her company with peer support job availability, so she was fortunate. I want to expand more peer support, but don't know how to start. So Bernadette, I'm going to talk about some processes or things that tools you might apply to looking at that particular problem. All right, so let me go on to, so oftentimes we test ideas by, say, we get a grant and do a 2-year pilot project. That is frequently how new services are developed. If folks do prototyping, generally they're prototyping it in a grant application. So basically trying to work out the details and putting it in and maybe doing a logic model. So those are the things, ways prototyping. And defining the problem might be defined perhaps by a SAMHSA grant that they put out, and they define what the problem is for us. Elected officials can define a problem. Community members who often are aggrieved. Media could define a problem. And then folks, how else do you guys see problems being defined in your work? Who does that, and perhaps how do they do that? Go ahead and type in the chat. Peers in crisis usually tell what their needs are. Good. The person served. Yeah. Exactly. So those we support, we ask them what they need and want and start brainstorming ways to address those needs. Yeah. So that is part of what we do that. So when we go to the next part, we're asked, and part of the thing is, how do we ask someone what they need or want? How do we get at that? And we can just ask someone literally and they can tell us. There's lots of other ways we can find out from them, because some folks, get that oral communication is not going to reveal everything we want it to. And that brings us to the next thing. So how do we empathize with folks with their with needs? So a lot of times in our systems that there might be testimony and legislative hearings where we're trying to tell stories. This is like in systems, grievances that are coming to the fore, outcomes data. You guys, I'm glad you're already going there talking about individuals with their experience and sharing that. And it's how do you share that experience, and where and to whom, and what tools you use to kind of put together and make sense of that. That is in new ways beyond just the individual themselves in that service. So that's my little thing. We're doing these ideation in the chat here. So I want to say that this process of developing new ideas is not linear. It's messy. So we're literally, while it looks like that you might go from empathize, define, ideate, prototype, test, just like most other things, you might go back and forth between different areas. As you empathize and develop a deep empathy, you might define what's going on, might develop ideas, but then that you realize that you need to go back and find out more information because maybe or you need to define it a little clearer. Okay, so let's talk about deep empathy. So, oftentimes we talk about a recovery or a wellness or a resiliency kind of journey, and back to this diagram, our expectations and reality. Of course, this is great as a concept to know that individual journeys are complex and go back and forth. There's different ways that we can dive into what that actually looks like and communicate that to others. We can really go deeper, even deeper, and really empathize with just a small part of someone's journey and do a deep dive. We're going to talk about a couple of ways that we can do that. So I'm going to use an example for this activity, and we're going to be having, again, some participatory stuff in here. Um, and we're going to use this problem statement that the number of Wellness Recovery Center participants is low. And I'll talk about what this Wellness Recovery Center is. Karen or Karen says, when the time is right, depending on what the topic is, you can self-disclose. Delivering the message is so effective when delivered with conviction. Yes. So let's talk about the Wellness Recovery Center North. This is a center I used to direct in Sacramento. Just want to give you an idea. This is what one of the meditation rooms. This was a calendar we had of groups. It was open 9 a.m. to 9 p.m. Monday through Friday, and 9 a.m. to 5 p.m. on Saturdays. Lots of groups, peer run. Okay. So the problem was, how can we get more people? We weren't getting as many people as we thought might. Well, no problem, Karen. Here. So let's start with empathy. How can we really empathize with the experience of the individuals coming? So there's lots of ways. As mentioned, we could just ask individuals and that can get us some information. We could do a survey. There's lots of ways, but let's look at a couple design tools. One of them is called persona development. So we're going to look at the persona of Sally, and here's Sally here. This is a publicly available image. This is not anyone in particular, not violating any confidentiality. It's a public domain image. This is so one of the ways you can develop kind of a composite picture of the types of folks who come into who you might be trying to reach. Now, you don't define that necessarily by diagnosis or anything like that. So let's look at, we got together as a team of peer supporters, of individuals who have used the Wellness Recovery Center, and we generated, okay, what are some of the typical characteristics of somebody that might be coming into the Wellness Recovery Center, or that we would like to. And we developed, we brainstormed, we ideated a number of quite a few characteristics, and we sorted them and created kind of what we call the persona. This is kind of a typical experience for folks, for somebody. And one of them we developed was Sally. And I modified this a little bit. This is so Sally is 54, living with widely swinging moods for 30 years. She feels empty, alone, regularly thinks of dying, has little energy. Sometimes she feels excited for a few weeks and likes to go to casinos. She's in enormous debt. She's worked on and off in part-time jobs. I'm just going to go through this. So these are some of the things that are going on for her. She loves board games. Was anxious about meeting new people. She lives with the mom and aunt at her mental health provider. She gets one therapy session every 2 months, and she has to go to a psychiatrist every 4 months, maintain services, but she doesn't want to be on medication. She really wants more help. So at the end of a session, Sally's therapist hands her a flyer and a calendar for the Wellness Recovery Center and encourages her to go. So we developed this idea, this persona of a typical experience. So we did that based on some research, looking at our data, but also about the people we really know and about what's going on. And then after we did this, we did a deeper dive. So for what else might be going on with Sally in her life? If you were to do this sort of ideation brainstorm, somebody who might come to Wellness Recovery Center, what are some other things that might be going on? You can go ahead and put it in the chat. Don't be shy. Don't be shy. One of the things about that there are no wrong ideas. That when ideating with design thinking, that you want to go over quantity over quality. That is one of the principles that I mentioned I was going to weave in. And they go for wild ideas. That some of the best ideas can come from something that seems really out there. So please type in, what's something else that might be going for Sally? It's just going on. You can type it in really quick. You think about your own experience or those that you've worked with. Yeah, due to low energy, self-esteem, it's hard for some to come out to new things. Yeah. So Bernadette says she might have low energy, low self-esteem, and she rarely goes out to do any new things, much less go to the Wellness Recovery Center. She's felt like that trying new things is difficult. She's used to being isolated, that she has transportation issues, that she's fearful of a group setting. Yeah, cool. So thank you, Christy. She's seeing a therapist, so she's making an effort to heal. So yeah, this is that's a great strength, that she is part of what she's doing, that she is making an effort. There is something motivating her to make some choices to move on. So I mentioned about ideation rules. So this is a very common list of rules for ideating. That means when you're doing it in a group, and it's best to do it in a group, is to defer judgment. That if someone puts out an idea, you don't just need to slap it down. Even if they say you're in a peer support arena and you don't want people to use diagnostic language, someone uses it, you don't just slap them down. You build on it, and maybe that's not what you use at the end. But you encourage wild ideas. You build on the ideas of others. Stay focused on the topic, one conversation at a time. Be visual, go for quantity. So here we're being visual by putting it into a chat so folks can look at what we're doing, not just hearing. Oftentimes you might see some sticky notes behind me, or on some of the slides. You can do sticky notes so everybody's looking at the same information. So you're not just looking down at a piece of paper and everyone's looking down. We're not just talking at each other, because lots of information can be lost that way. But go for quantity. Try to get as many ideas as possible. So here's some examples. Some of this is from the workshop a couple of these pictures are from the workshop that I did in Orlando. The on the bottom left are from ideas that the Wellness Recovery Center that we putting up a chart paper in some of our group rooms and what have you, and having people put their ideas about what they would like to see, what's going on for them. So it's really getting it out visual. You can also do a survey so folks put it in, but this way you can see other people's ideas. You go, oh yeah, I like that one too. Or what does that mean? You can do it at the same time, or you can also do it asynchronously. You can leave something up and come back to it. All right. We did that. So one of the things we developed a few different personas. And there are other ways to do that. If you were to Google persona development or creating personas, some places will call them avatars. You can have two lines where you have two different axes, where you see someone who's really motivated to make change versus a little motivated. And you can have some other dimension, and kind of see people in four different areas. And the idea is you're trying to develop something for that person. And that person is going to be representative. So whatever works for that person is going to affect many people. Obviously, when you're doing peer services and just working one-on-one with somebody, you are doing with just that person. When you're trying to do something that's going to impact many people, there's some ways where you can kind of create this composite. So the next thing we talked about is a journey map. That we want to talk about is a journey map. So using Sally's story about what she's doing, we really looked, okay, what is her journey? And in this case, we did like a literal journey from the time she got this flyer here to the center to the time she walks in the door, and to what is happening for her. And we really thought about, based on our own personal lived experience, the peer support specialists of our lived experience, from the talking with our peers who are coming to the center. And so some of the things, we really looked at some markers. So that she gets this referral, and this is just given a flyer, that she sits on it for a long time. We put sit on it in quotation marks. That she just puts on her nightstand for maybe a couple months. One day she calls Wellness Recovery Center. And the next stage is she actually, her a literal trip to the Wellness Recovery Center, arriving at the building and walking inside. We could have broken this down into lots of different ways, but those are some of the key moments that we thought for her journey. And then we think about what are some solutions we can do to help her on her journey. So I'm not going to read all of these, but one of the things then of each of these, we asked, okay, what is going on for her? What is she thinking? What's going on in her life at each of these stages? And these are some things that some of us don't have to reach for very far. And some of the things you guys have already mentioned here. The provider told her, just call the Wellness Recovery Center. Well, what's going on for her? Looking for something different in her life, like was mentioned earlier. She wants more one-on-one time. Phone calls are hard. She's also thinking that session was hard, talking about my trauma. I can't do anything else right now. There's no way I'm going to go to this place right now. That the flyer, she's sitting on the nightstand over a couple of months. She's wondering how she's going to get there, what the part of town is, who will be there. I don't like crowds. I hate groups. They'll see the scars on my arms, but it's hot for long sleeves. So thinking about, okay, what is going on might be going on. She called us, begins to think about it. She borrows bus fare from her aunt. And when she's doing that, she's thinking about she's lonely, she's frustrated by her family, she wants to feel better. It's a better day than usual. I don't like this area. She gets off the bus stop. Where's the sign? Why am I so stupid? Looking around, stands by the door when she walks inside, makes a 3-second judgment. Who do I talk to? They all look busy. I have to get out of here. That these are some things that might be going on for some of our folks. And looking at this composite person of Sally. And so this is, and then we kind of, you can talk about visually, coming emoticons or something to visually represent, or someone, if you're good at drawing, that should be drawing a little picture about what that experience is like. So we can see her journey is like tearful, super anxious, a little less anxious, not super empowered, but willing to go forward, scared, and questioning. So that's where we are with empathizing. Let's see here. What are some other steps along her journey here that she might have? What else could it be going on in her life? Please use the chat. To share what else could be going on for Sally. You guys already had some great ideas. Let's build on those. So thinking about building on some of these is like isolation, trying new things that are difficult. Maybe she's only ever been out of the house to go to therapy for the last 6 months. It's the only time she's been out of the house. Yeah, she has a conflict of how she wants to make a change. So she might be thinking about different options she can make besides the WRC. That's great. That there might be something else, that maybe she's thinking about some other things that might be more healthy than others. So she could be thinking about, maybe instead I want to go get a new therapist, or maybe instead I want to go move in with my boyfriend because he'll take care of me and everything will be fine. Or maybe instead that she could have so many different things. Maybe instead she wants to get on a bus and go across the country. Even though she's terrified of crowds, that she has lots of things, lots of ideas. So we're in the empathize. Now looking at defining the, so we took that information And we changed our problem statement, our definition from the number of wellness recovery center participants is low. And we looked at, okay, what's really going on for her, not for us, because that's what's going on for us, is that our participation is low. So that's not user centered, that's not person centered at all, right? That is just program centered, and that's where people don't serve programs. It's supposed to be the other way around. So, and we came up with that individuals feel lost and uncomfortable. And we actually formed a work group after that called Lost and Uncomfortable, which was looking at different ways we can help folks so they feel less lost and less uncomfortable, so that they are able to feel, if we want folks to feel less of that way in each of these areas. So what are some other ways we could describe her experience in general? She's lost and uncomfortable. What else is going on for her inside? What else? What other unmet needs might she have? I'll wait for at least 2 ideas. As promised, this is a webinar that needs participation. Concern, possibly excitement to do something different. So yeah, we could have named this excitement and fear, anxious for change. Yeah, it could be. Yeah, so anxious for change. We could have called it that. Those are how do we help someone who's anxious for change? Thank you, Christy and Stacy. So there's no right way or wrong way. Again, like looking at that process, you can go choose lost and uncomfortable as you're trying to address that. Go, you know what? This is, as we're going along, that's not quite it. It's that people are excited and anxious. Maybe that's what the problem we want to solve instead. And then you can go back and work on that instead. So some of the things that we were looking at defining what was going on is that looking at, okay, for at the very beginning of the process, that some providers don't understand Wellness Recovery Center. That unfortunately, even though we're a peer center, our conversations were very business-like. We identified that when looking at what we're doing. And we think, that's not good. Folks can't tell where the office building complex is. That is, where the building is in the office complex. So we're in this larger complex, and there is Wellness Recovery Center embedded there. They couldn't tell where it was. And unfortunately, even though it's sad us to admit that folks weren't always seeing a human face within 3 seconds. Bernadette said, I see so many that tell me they don't like new things or it's not comfortable for them. Yeah. So that's one of the common things. So we looked at and we defined these 4 different problems that providers don't understand. Conversations are very business-like. Can't tell where the building is in the office complex, and no human face within 3 seconds. I felt like each of these were contributing to people feeling lost and uncomfortable. So then we took those definitions, those ideas and definitions, and started brainstorming. You notice that we spent a lot of time before we started brainstorming ideas to look at some specific things that's really going on with folks. So some of the ideas, and we're not going to do this too much, is we felt like this was obvious. But it's also not that we'd never thought of educating providers before, but we realized that this is one of our priorities now. We make sure that we disclose our peerness on the phone. That wasn't always happening. So that's how that folks can feel more connected. Someone has shared lived experience, and sadly, we weren't always doing that. So it's then you got to say, hey, okay, well, we can make that change. Outdoor signage seems so simple, but for in our complex, the people who own the property, it's a really big deal to try to add outdoor signage. We thought of it before, but we thought, okay, it's probably just not worth the trouble. After this, we decided, no, this is worth the trouble. worth the advocacy, worth the pain in the neck. We need to do something. And we decided to move the welcome desk closer to the door. So these are the ideas. We had many ideas. We had vast numbers of ideas of things we could do, of defining the problem and of different ideas of what we could do. Again, go for quantity. And then for each of these, but frankly, the ideas here, we've done so much thinking of ideas that there are some solutions seemed obvious, but we also looked at, okay, educating providers, that's really broad. Then you start to define, okay, how do you educate providers? And you go back to, for that, you would go back to empathy. Okay, how do you empathize with the providers? What's going on for them that they don't understand us? What's going on for them? How can we meet that need of them of being able to effectively talk about what our program is? So then looking at prototype, and we kind of had a design plan. We went back to defining again and defined it based on this prototype. So many individuals feel lost and uncomfortable from the time they hear about Wellness Recovery Center through the time they step to the door. We will prototype, moving our welcome desk closer to the door, adding more outdoor signage, disclosing our appearance on the phone, and educating more providers about wellness recovery centers. So, sorry, I went on too fast. So we decided we were going to prototype each of these. That meant that we did not move our desk closer to the door right away. We prototyped that first. We did not immediately just start sending out flyers or just calling up providers for presentations. That's not prototyping. That's actually moving to action. We did not immediately call our landlord and say, you got to get us some more signs. That's not prototyping. We don't have time to go into this to a huge amount of detail, but here are a few principles to keep in mind. So we want to think low fidelity, think cardboard and crayons. Literally do that. It's going to make you go back to kindergarten and you go back in. Frankly, this is something that's accessible. So, for the signage, we just put up some temporary, just got a piece of paper, wrote on it, WRC that way, just taped it up on some places and see, okay, which places were most effective that people were seeing. Obviously, leave it up for a few days or until the landlord would tell us to get down, but he wouldn't see it in a few days. We felt like that was doable. People and seeing, okay, how could we describe it? How big should we put it? How big does it need to be? What locations are great? What colors might we want to use? And trying different versions of that. Do we need to actually put it on a stand out there rather than on a window? Does it need to be, how far out does it need to be? If you make the decision too quick, then you pay all the money for whatever you've got to do, and you realize it's not going to work. Well, it's hard. All of us have limited resources. So fail fast. Put up that cardboard and sign, and say, that didn't work, or that's people are smoking next to that sign, and so you can't see it. So okay, let's move it somewhere else. And it can be really that simple. But the idea is that you're doing it in a real intentional way. You're not just putting something out there and trying. You're actually thinking about it. Rapid iterations, that means trying it over and over again. And a minimum viable prototype, that's a concept from product development where you just make the very basic thing. You think of where you just make, okay, what are the minimum things to make this work? What are the minimum things to make this work? And say, we have to have information. We have to have a thing to put the information on. Okay. And then you, after you've prototyped some, you can then start to test a little bit more. So one of the things we did with the desk is we put masking tape around where we wanted it, and then had people sit at the front desk, said, okay, if you're here, how do you interact with that? We have the folks, our members, work with us on this. Okay, where would be a good place to put this desk? Folks, when we empathize with folks, we were talking with them about We wanted someone friendlier, but what was too close? What was so close that, okay, whoa, there's someone right there. What was enough space so that we could have places to work? Where were our phone jacks? And so really taping it out and using, folding tables, because we had a big heavy desk and some other things that we're gonna have to move if we moved it. And so taping it out rather than shoving our huge desk around or doing anything like that. So, and really then in prototyping, trying it out with people who are going to actually use it. So trying out with the folks, asking our members, how's this work for you? What did you like about this? You like someone sitting right there? Cool. What are your feelings when you come up to it? So really, and as we know, some small things like having a friendly face close enough but not too close when you go in somewhere can make a big difference in how someone experiences going in. And before we did this, we didn't realize that we were too far away that for folks to feel welcomed. So in the time we have left, we're going to do, I designed this so we would run out of time before finishing all of this. So we are going to go and look at another persona. So you can, before we do that, let me just say, you can do this with any issue you're having. You can do this with going back. The journey map is one tool, persona. It's really going back and spending a lot of time empathizing with the experience of someone's going on and capturing it visually. If you are listening to your folks who are telling you what's going on for them, write it down, put it somewhere where everyone can see it, on a sticky note, on a poster, draw a picture. That excitement, if you have everyone drawing pictures of what their experience is like with something, put those up there together so that you can see them. Wow, what do we notice of themes? There's a whole lot of anger up here. So get it visual so that however you're getting that information, empathizing, you can put it up visually so that, and collaboratively with multiple people from different perspectives, think about what do we notice about this? What can we define as some of the things that are going on? And okay, so your turn, persona development and journey mapping. Going back to empathizing. So this is a persona I used, and this is one that some folks could decide you want to use a diagnosis. That is because it's important, not because you think he does or does not have schizophrenia or you believe in that, but he was given that diagnosis. So looking at someone completely different, he's 24, diagnosed with schizophrenia years ago, voluntarily hospitalization. He's angry, wants his parents to leave him alone, so they control him, and he finds this through a Google search. What else might be going on with Juan here? What else besides what those few things we listed? What else would be going with the experience? He's wanting independence. He does not have his own transportation. Yeah. So he's wanting independence. That's flipping the angry and wanting his parents to leave him alone, flipping it on his head. Yeah. Doesn't want anything to do with mental health or recovery. Oh, that could very well be. He has a support system. Parents, he does have a support system. So he has some things going for him. So one of the things is that I like to do with these sorts of things is that we're trying to, and Christy's really getting at this here, is that it's really easy to think of problems. One of the thing about ideating is you keep going, get all those problems that you think that are foremost in your head, get them out, and then start thinking about, okay, what are the other things that are not just problems? What are the things that are strong? What are the things that are good? Getting a lot of those out. Great. So those are some of the things that might be going on with Juan. And so you look at, oh, Anna says limited natural supports. Yeah, he might not have anybody else besides his parents. So it said that he's considering going back to college, Barbara said. That, so he might not, he has his parents, but maybe he doesn't have anybody else. Or maybe we could define he has one other person. Yep, that's what he's thinking about going back to college. Great. So this is, so even though this is not, there isn't a one, there is kind of a one. Somebody who is in that sort of, those kind of constellation of needs or experiences, and those that are different than Sally's. So Juan's journey. So just quickly, what are some of the things that Juan's journey might look like? If you remember what Sally's looked like, what was his little journey from the time he Googled, well, and found Wellness Recovery Center? What might be between then and when he walks in the front door? Might call Wellness Recovery Center. Good. Now, he's wanting connection with like-minded people. Yeah. And maybe he's thinking about that a lot. Or maybe he thought about it for the first time after Googling it. He might email Wellness Recovery Center. Yeah, he's sitting right there Googling it. His next step might be to send an email right away. And looking further down the line, if you're looking at problems, hey, are we responding to our emails? Do we have like an auto reply, going like, thank you for your email, we will get back to you. Yeah, that's some of the things he might do is ask if we have transportation. He might tell his parents about his interest, and they could either be excited or not so excited. Requesting info from Wellness Recovery Center. By contacting Wellness Recovery Center, he will get a taste of peer support. So hopefully you'll get a little bit. We might provide transportation. Yeah, so that's some of what might be going on for him. Being with people who understand what he is going through. So yeah, you could have that strong desire to be with someone. He could have a very strong desire, and unlike Sally, maybe he goes that same day. Maybe in this person is someone, a warm line. Yeah, he maybe has contacted a warm line. Maybe that's the next thing he Googles. So he has a positive call. He has motivation to visit. Yeah, so we could talk about that motivation, and what we're getting here is like maybe he is super motivated. He is out there. He's going to go do this right now. This is his time. I'm going to connect with people who I want to. So how then we look at that the super motivation that he gets transportation by and that very day he's either borrow a car or he gets a ride or whatever it is, that he gets there that very day. He makes sure that he gets stressed, all those things. And yeah, he's motivated. He might be motivated to get away from parents. Yeah. And so kind of defining what his journey is along the way. Went forward too much. So then looking at each of those points of the journey, how can we better get someone who's really motivated? Because maybe he goes in that front door and we're used to people who are not so motivated. And maybe we're better at engaging with people who are not so motivated or somewhat thinking about it. Maybe that there are some needs he has that we're not capturing that energy and looking at that and what we might be able to do differently. All right. So the idea is to spend time at each of these steps. Don't go, even though this is a 1 hour webinar, that you want to go through them. You don't have to spend a lot of time, but don't move through the steps of ideas and recognize we need to go back. We need to go back to, okay, well, what has he done in the past that's been motivating for him? You know, that's, you can go back a little bit. All right. So 5 minutes left. There are lots of design thinking tools, and you can invent your own. I've just given you one way of doing journey mapping. There are lots of other ways just to do journey mapping. There are other ways to develop personas. Lots of, there's no one way. You can adapt it for what's going to work for you. It's not like it's not like engineering where you have only a certain way you're supposed to build a bridge or else it's going to fall down. This, or a certain suite of ideas. This is the idea to go back there. So I've listed a number of ideas. Storyboarding, that's literally where you like draw little cartoon panels. And you could do that with about him literally talking with his parents, Googling, and kind of draw what's happening in the experience. So when you're thinking about somebody's experience, say going to the hospital, if you were on to looking at that, you could storyboard each section so you can see it visually. You can Google any of these, get some ideas. There are thousands of them. Some of them are, the thing they all have in common is that they all get, well, almost all of them have in common is they get to something that's visual. And then we have interviews, of course, that's an interview, but then how do you get that information and organize that? There are ways that our researchers do that. There are ways that people who create new products and services can do that. Design brief, that's something where you're literally defining what you're trying to solve. And it's like a one-page thing. Napkin pitch, that's just a brief, your 30-second, that's your thing when you see in Shark Tank. That's a kind of a napkin pitch. You're saying, here's my idea, here's why it's important, why do that when you've got these ideas. So it's really making it small rather than a huge 500-page, well, exaggerating, a proposal for a grant. Maybe it needs to turn into that. It doesn't start well with that. So encourage everybody to go design. Again, get things up and visual. If nothing else, I hope you take away from this, when you're trying to think of new ideas with a collaboration of people, you can do it individually as a peer supporter. Get the ideas out from just in your head and in your mouths, or even just on a paper, different pieces of paper that you're all looking at, and get it so you're all looking at the same exact thing at the same exact time. So you're all looking at the same sticky notes that are up there. You divide them in small groups and do each of them, but get it up there so you're all seeing, because a picture paints 1,000 words. So somewhere can download the slides. I don't, Martha, do you?
Michael, if you send me the slides, we will put a PDF of the slides
Okay.
on the website with the video. It will probably be next week.
Okay, I'm happy to do that. And thank you, everybody.
I want to thank everybody for coming too, and we're glad you're participating. I'd remind you that the conference registration is open now as well if you're interested in going to San Diego in October. And the call for proposals actually is open till the 1st. So if you have an idea, put it in, please. Thank you all. And thank you, Michael. It was amazing.
I'm glad to do it, and I appreciate the participation and the opportunity. Thank you.